coping with anxiety and stress amidst the COVID-19 crisis. My name is Dr. Mohammed Abbas Kaki, and it's my honor and pleasure to be with you here today. We have a fantastic panel of experts, scholars within the field who are going to guide us through, and we really welcome all of your questions and input as much as possible. This is a very strange time. The COVID-19 crisis has encapsulated our attention. It has caused a lot of panic. It has caused a lot of anxiety. We are hearing stories of people becoming unwell, loved ones. We are losing cherished people within the global community. But then on the other hand, we have this incredible time of Shahr Ramadan, a time when we come together, we reinvigorate and re-energize ourselves, we reconnect spiritually with Allah subhanahu wa ta'ala, but also we normally would see our friends, our families, our companions, our colleagues, and spend time with them and re-energize and refocus. We are in unprecedented times. We are not able to do that. We are virtually meeting. And so I'm very glad to see everybody joining us for today. But because of that, we are thrown up with this incredible challenge. How do we cope with the anxiety and stress that's been brought about from COVID-19? How do we deal with all of the tension we have today? Well, I'm going to start with coming to one of our main speakers, Dr. Shamali, Sheikh Shamali. But before that, we have one of our panelists, Dr. Farzana Karawali. She has her father unfortunately passed away this week. And we wanted to have a Surah Fatiha for him. And his name is Murza Hirji Walji. So please can we recite Surah Fatiha in his remembrance before we begin. Bismillah ar-Rahman ar-Rahim. Alhamdulillah Rabbil Alameen. Ar-Rahman ar-Rahim. Maliki yawmiddin. Iyaka na'budu wa iyaka nasta'een. Ihdina as-sirata al-mustaqim. صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. So we are going to start now with Sheikh Dr. Muhammad Ali Shamali. Now, for many of us, he requires no introduction, but I will introduce him because this is a global audience. He is a graduate of the Islamic Seminaries of Qum. He has both a BA and an MA in Western philosophy from the University of Tehran. He's earned his doctorate in philosophy from the University of Manchester, and Dr. Shamali has several publications in English amongst other languages. And he has just come from teaching a class elsewhere, so we're very thankful that he's made the time for us. Sheikh Shamali, I'd like to intro your segment by asking you about some of the things that we're suffering from a spiritual element. How do you cope with hope and optimism, and how do you keep that alive, especially during Shahr Ramadan? The coronavirus pandemic has caused the world to become upside down. Nothing seems normal anymore. Our mosques are closed. We don't get to see our relatives. We don't get to see our friends. How do we keep positive during this period and in fact utilize it for spiritual growth? Sheikh Shamali.
Thank you. Bismillah ar-Rahman ar-Rahim. Alhamdulillah Rabbil Alameen. Sallallahu ala Sayyidina Muhammad wa ala tayyibin at-tahirin. I say my salam and greetings to everyone, and I also offer my condolences to Sister Farzana. May Allah, inshallah, bless the soul of her father. Actually, I think our situation right now is a very good wake-up call for all of us. Because unless you are challenged, you cannot really evaluate your capacity, your determination, how much you have achieved so far. It's like you study, but you have no test. If you take no test, then you don't know have you learned or not. Someone should ask you. We human beings are very special. Normally we think that okay, this is the way I am born, and this is the way I am brought up, this is the way my character is built. There is nothing that much I can do. And unfortunately, sometimes also modern, psychology would give this impression that every person has a condition, and these conditions are fixed. And sometimes, they say, he's because of his genetic, or because of other things, and they give a name, and then people think, okay, for the rest of my life, I have to suffer from this. But the reality is that human beings have great potential to build themselves. We have unlimited capacity. Sometimes I say Allah subhanahu wa ta'ala is infinite and we are finite. But the only thing which in us is unlimited is the capacity. We have the capacity to improve and become better and better forever, and we would never reach the end of it. And we can go downward and we would never reach the end of it. The same is with skills, with talents, with learning, with information. For example, how much our mind, how much our brain can absorb. There is no limit. Actually, the more you go to the path of knowledge, the more capacity you have. So human beings have this ability to decide for themselves, to decide what type of character they want to have. I cannot change the world around me, very little, but I can change the world inside me, which according to mystics is the greater world. This is Al-Alamul Akbar, the greatest world inside me. Maybe I cannot choose who are my neighbors, who are my colleagues, even sometimes maybe I cannot even choose the people in my family, whether these are the best people that I want to be with or not. But my relation with them has two sides. One side is me. And if I change myself, the relation will change, because every side of the relation, when changes, the whole relation changes. The same office that you go, if you are going to the office, for example, with a good mood and you are very happy and joyful, you see every person today is different. When you are upset, everything again, it becomes upsetting. So what I want to say as a message to take away is that there is no limit for us in making ourselves better. And the more you have worked on yourself, the more virtues and qualities and knowledge and wisdom that you have taken on board, the more you enjoy times of loneliness. So actually, a sign of progress is how happy you are when you are alone. We love to be with people. We love social interactions. And in Islam, as you know, being part of family, part of community is very, very important. Lots of emphasis on anything that can bring people close to each other, reconciliation, and lots of condemnation for anything that divides people. That's there. But in the end of the day, your value is based on how much you have taken inside. That is what you can take with you to the hereafter. I cannot take my relations with me to the hereafter, but how much I have benefited from these relations by helping people, by serving people, by learning from them, by communicating with them, how much I have added to my hasanat or to my qualities. That is what I can take with me. So when times like today happens, is or when you travel alone, when you are sometimes, God forbid, in the hospital for a few days, that's the time to examine yourself and see how much you have achieved. People who don't like to be alone, is because they have not invested that much on themselves. They have tried to have beautiful, house, beautiful curtains, beautiful, paintings, but inside is not that much decorated. So I see this is a time for evaluation. It's a wake-up call. And just a minute, faith and hope are very much connected with each other. A mu'min should never be hopeless. There are problems that maybe we think these problems are overwhelming. But first of all, this is not the first time such problems. There have been much, much greater crises in the world, and humanity, with the support of Allah, has passed all of them. This is a big problem, but not a crisis like, world wars, for example, or some epidemic in the past that millions of people were killed. And Allah subhanahu wa ta'ala is in charge. Allah subhanahu wa ta'ala is the supporter. Allah subhanahu wa ta'ala has, for every person, this is very interesting. If you refer to the tafsir of this ayah, له معقبات من بين يديه ومن خلفه يحفظونه من أمر الله. Our hadith says every person has two people, two angels to support, unless the decision of Allah comes, and then of course they are obedient, and then this person may die or have illness or whatever. But lots of support are there for human beings and in general, but for mu'mineen in particular. Our hope is in Allah, our trust in Allah. Nothing can challenge Allah subhanahu wa ta'ala. We just need to do our little part with patience and wisdom, and be sure that unless the plan of Allah for end of this world by coming of Imam Mahdi and establishing universal peace and justice happens, this world is not going to change or to end or to destroy. I think I stop here so that inshallah we would benefit from other speakers.
Ahsan, thank you so much, Sheikh. That's a fantastic message. I've already, my small piece of paper is full of notes that we will discuss inshallah shortly. So thank you so much for that. I'm going to move on now before we come to some questions for yourself and our next speaker. We have Sister Farzana Hirji Karawali. Now, to many of us here in London, she needs no introduction. She has been an activist for a long time, but I'm going to read out her bio for you all. She is a social worker. She's a learning disabilities nurse and therapeutic life coach, practicing CBT and NLP. She has a lot of experience in mental health and is the founder of Inspirational Minds, a service that helps people with social, emotional, and health needs at Hujjat Stanmore. And she has, for people who are watching and are looking at the panel, one of the remarkable things about Sister Farzana is that she has just recently lost her father only a few days ago. And yet she very bravely approached us and said, I want to be part of this program. I want to talk to people about grief, especially in this early stages. And given the COVID-19 crisis and given everything that's happening and the fact we are losing loved ones, I think it's absolutely brave and incredibly generous of her to come on to speak. And so she'll be talking about how we deal with grief and loss. And I'll be asking you, Farzana, what lessons can we learn about having patience and having faith in the hikmah of Allah subhanahu wa ta'ala in taking away the loved ones? Farzana.
Assalamu alaikum.
Alaikum assalam.
Thank you so much for the introduction. I'm going to keep my notes in front of me because obviously I've had a very difficult day. So Bismillahir Rahmanir Rahim. Why do we feel grief and sorrow? As well as being spiritual beings, we're also emotional beings. And this causes us to form attachments with things, with animals, with people, with objects, with books. When we lose something that we're really attached to, we initially go into some kind of a searching phase. If it's a physical item, we'll physically be searching for these things. We'll go around the house, we'll go in the car until we find what we're looking for. But if it's a lifestyle that we've lost, something's changed, that's very difficult. And we tend to kind of find ways of filling our time. We feel very confused, we feel very disorientated, and we try to form some kind of a new structure and a new routine. But if it's a person that we've lost and we're searching for them, what we tend to do is we tend to search in our mind, and we go into the past and we try to bring that person from our mind into our present. And that doesn't really work, because you can't bring somebody from your mind into physical presence. What it ends up doing is making you feel more and more confused, because you're revisiting memories repeatedly. You're revisiting questions repeatedly in your mind, and that makes you feel more sad and more confused. So what can we do? We tend to want to find answers. We have all these questions. What happened? What could I have done? How could this have been avoided? Something's clearly missing when somebody is lost. It's a big piece, a big chunk in our life. And what do we do? How do we deal with this? So this is as far as I've got with my process of grief. When my father went into hospital, we felt the issue was something quite simple and could be resolved easily. Little did we know that there was a cocktail of issues that would be an excuse for him to return to our Lord. And I say excuse because I know that whichever way we look at it, that is the fact. We could say anything, but at the end of the day, he had to return to his Lord. My grief and sorrow did not start at the point when my father passed away. It started when he went into hospital, when we began to understand the complexities of his health, the issues that he was facing, and knowing that he was alone and far away from the family. I see flashbacks of the family session that we had on House Party, not that long before he passed away, where the reception in the hospital was very bad, and he kept falling off the call, and we'd try and put him back on, and he'd drop off, and we'd put him back on. Little did we know that within a few days, a few weeks, that he would no longer be with us in our lives, and we can't just pop him back on. I hear the call of my brother giving me news about how complex Dad's health was, and I remember the day, I remember the time, I remember where I was. I remember calling the doctor at 1 a.m. because it's so hard to get hold of doctors at this time with so much pressure on the hospitals. And I had a long conversation with that doctor at 1 a.m. telling me that my father has only 2 days, which are extremely critical, and that all we could do was to pray. I remember the comeback that my father made on that Monday morning after that 2-day weekend, and the prayers that we made, the pleading that we did to Allah, the 12th Imam, to ensure that we don't lose him, that he stays with us, to do whatever we could to at least, send some blessings his way, and inshallah hope that he would stay with us. But the joy on that Monday morning when we found that Dad had actually fought through and was given a chance again, that was something else. I remember staying up till the early hours of the morning every day after that, making sure that I did as much amals, duas as I could to make sure that he kept in good health throughout his stay at hospital. I would make that last call at 1, 2, 3 o'clock in the morning after I'd managed to get hold of that doctor. I remember the time when we actually started missing his calls, and then we started noticing that he wasn't texting anymore. And again, the week had passed and Friday came, and we were told that we had 24 to 48 hours on, again, a Friday night. And this time they didn't have much hope. They said there wasn't much that they could do for us. I continued searching. I continued to find a fix. I'd call the doctor and ask, what possibly can we do? What more can we do? Have you checked these stats? Have you checked this? Have you checked this? And my brother told me with the same firm voice that my dad used, it's time to stop thinking about us and it's now time to start thinking about Dad. Yes, I went into shock. I was in the bottom of the garden in my cabin when I received the call. I was sitting on a chair and I was stuck to that chair. I could not get up. I couldn't even tell anyone. I couldn't get up to tell my husband. I just sat there feeling sad, crying, cold. Tears were flooding down my face. Hours went by. It became Maghrib. And through whatever thought came in my mind, whatever du'as, whatever came in my mind, I just kept reciting for hours. And at Maghrib time, I suddenly got some sense of relief over me, because I remembered Bibi Zainab's words where she said, I see nothing but beauty. I had to gain control of myself for the sake of my family, and I had to stop searching. I had to accept and become part of the present time, not think about the past, not think about what could be, to think about the now, what's happening now. We had to give my dad his haq, his last rites, one of which was today when we laid him to rest. And why am I telling you my story? Because I want you to know that there is no shame in grief. It is a process that many of us have to go through at any point in our lives. It could be for many different reasons. It could be our health. It could be something small that we're grieving over. It could be something large. It could be grief that lasts for a long time. It could be a short time. It could be the loss of our health that, as you know, can happen to us at any point. And there is no shame in reaching out to somebody and saying, I need help. Yes? Most things that we do in life, we kind of learn from making mistakes. Those mistakes give us some level of experience. So then why do we expect that we're just going to be able to manage grief? We don't have experience in grief. We need to understand that grief is normal. Feeling sad is normal. Feeling low is normal. We need to be able to communicate our feelings to people. We need to maybe be able to find friends that we can speak to, professionals that we can speak to. We can even speak to Allah and the Imams, but we need to ensure we communicate. What we can do is also write our feelings on a piece of paper. If we can't deal with them there and then, that's fine. Get a blank piece of paper and write everything that you're feeling. That way you don't lose your feelings, you don't ignore them. Because what happens when we ignore our feelings is they just come back stronger. Like when we speak to a child and we tell them, no, you can't have this or you can't do this. What do? They come back even stronger. And that's the same with our feelings. Sometimes we feel guilty. We feel that, we've not done enough. I didn't see him enough. And the list can be endless. But why do we feel guilty? What we're doing is just punishing ourselves. In fact, what guilt is just us thinking about ourselves. The loss is not within us. The loss is within the situation. We don't have control over situations that are outside of us. The only control we have is over our feelings. So we need to ensure that we try not to take in negative feelings such as guilt, because the situation we cannot change. I've seen clients through the work I do as a social worker, a nurse within Inspirational Minds, and I myself have also experienced loss. So I've seen this before, but I've never had to climb the mountain that I have just climbed. I've never had to feel what I've had to feel. And what's made this easier for me is to know that I have a team that I can reach out to. I've got friends that I can reach out to. And there is no shame in me reaching out to people to help me if I get stuck in my emotions. Yes. And because of this, of wanting to kind of make sure that people are helped, I set up a service which Dr. Muhammad Abbas Kaki has obviously told you about, Inspirational Minds in Hujjat. That was about 5 years ago. Alhamdulillah, the team has become very strong. We have a very large team and we have many referrals coming in quite regularly. I feel that we can maybe set up something like this in many of the Jamaats. We have so many professionals out there that can group together and set something up and form a network for people, so that they know how to reach out. But on top of that, we need to reach out to people when we know people are struggling. We shouldn't feel that they're going to feel bad. We need to reach them and maybe touch their heart. And when they are ready, they will come to us. I feel that having a service within our own community is very helpful, because if we go outside, people don't understand the culture, they don't understand the religion, they don't understand our values. And it is so hard to talk to them about what we're going through. So if you have any questions about maybe how to set up a service, what more we can do, I'm happy to answer them. Thank you very much.
Thanks so much, Farzana. That's a really, really powerful message you've given. And I think, being someone who's part of Inspirational Minds, that it's an incredible initiative, and there's so much learning we can have. And I know that people around the world who are watching this will want to get in touch to discuss it. And I think one of the things that has come out that's really powerful from you sharing that story, and I think it's a huge issue in our community, that we always hold things in. We don't share them out. We don't tell people how we're feeling. And actually, what we need to learn to do is normalize how we are feeling, and giving each other permission to say that I'm feeling upset, I'm feeling how I'm feeling, and then looking at how we can tie in many of the things that Sheikh Shamali has said in terms of the spiritual aspects of how to then cope and deal with it. Really powerful things he's mentioned in terms of, and I'll summarize for people so that they can, if you're tuning in now, you're getting a small inkling into it. But he mentioned investing in yourself, and that Alam al-Akbar is the world inside us, is the most important world that we need to affect change within, and that faith is irrevocably linked, undeniably linked to hope, and the two go hand in hand. We have had some questions coming in for Sheikh Shamali, but I'm wary of time, and what I don't want to do is I don't want to stop Sheikh from answering in the fullness and giving us all of his wisdom. So the questions are going to be ones I'm going to bring in a little bit later, once we've had a few more speakers, and then we have a big Q&A session, if that's okay with you, Sheikh. What we'll do now is we will move on to our next speaker, who is Sister Zamina Mitani, and she is the co-lead for the World Federation's mental health stream. And this is one of the reasons that we're running today's program, because it's so important that we, as a global community, talk about this issue. And this really will be probably the first of many, because we're just scratching the surface. To ask any of our speakers to just speak for 5 or 10 minutes is really to do an injustice to them. They've so many things they want to tell us, but this will inshallah be the first. So she's leading on this, and she's completed her master's in bioethics. She's doing that at the moment from Harvard, and she's very passionate about ethics in mental health care. And she's volunteered for a suicide crisis line and is engaged in research on women who have substance use disorders. So this is a really incredible person for us to have on the panel, because, as you know, these are all elements and areas that are taboos. We don't talk about this within our community. We need to. We're passionate. We must start talking about that. And we're very lucky we have Zamina here. Unfortunately, she only has 10 minutes, but she's going to tell us about the World Federation COVID-19 Task Force mental health stream and how someone can seek help through it. So please, please listen carefully, because this is going to be very, very important for all of us. Zamina, please welcome.
Thank you so much, Dr. Khaki, for that lovely introduction. Bismillahir Rahmanir Rahim. Assalamu alaikum, everyone. I first want to extend my heartfelt condolences to Sister Farzana. I think hearing your story really brings this home for a lot of us and makes it very real and tangible. And I commend your bravery and your courage for coming here, and thank you for sharing that with us. My talk will hopefully be very brief. I'm here as the co-lead for the World Federation Mental Health Crisis Line. Mental health, as you all know and are probably here listening because is the crisis within this epidemic, and it'll exist long after this epidemic is over, and it exists and thrives within this epidemic as well. So I think it's incredibly important that although we have a lot of challenges and a lot of struggles, we are here today united and talking about mental health, which I think is an incredibly important first step. What I want to do today is introduce parts of our strategy, but I will raise more issues than I bring solutions to and bring initiatives to. And that's because this strategy and these ideas are in their infancy, but it's also because I don't think these solutions can come from a top-down approach, but they need to come from within Jamaats and within communities so that we can all learn from each other and build shared capabilities. Like we just heard, the Inspired Minds initiatives, all of those things can really enable us to bolster this strategy on the global level. So I hope to raise more ideas and have this be a call to action. The three themes that I wish to talk about today are community resilience, communication, and collaboration. So for number one, community resilience, I want to emphasize first that mental health really, as our communities have it, can be more of a preventative strategy than something that we treat post hoc. So really before someone gets sick or before we have that event, we can do things as a community together to build capabilities and build resilience that enable us to really do things that bolster people's mental health. And in my opinion, mental health is not necessarily, when we think of depression, anxiety, and strength, but and stress, for example, but things like food insecurity, if you have no running water, if you are unemployed, if you've just lost your job, if you're managing children and, caring for people that you normally would not be caring for, those things are very stressful. And I think, even the lack of religious programming during the month of Ramadan is very stressful for people who, might normally have that as a source of comfort for them. And so, in my opinion, I think when we focus on things, and I want to congratulate certain grassroots initiatives like grocery delivery services, calling up the elders within our communities, linking vulnerable women to domestic abuse shelters. These are local initiatives that are currently happening, and I think these are mental health strategies. And so on the global scale, what we want to do is really help communities with the back end work that might be involved in making some of those initiatives easier. Like, for example, collating resources, building networks like, they have in the UK and other places in the world, both in the global West and the East, and really enabling for there to be a point of contact within communities and a transference of knowledge. And I really want to emphasize when I talk about community resilience, who is our community? And I would argue at a time like this, for those who have the privilege to be safe, have a family that is safe, food that is taken care of, governments that have some level of healthcare infrastructure, that our community is not just our local region and not just our families, but our communities extend into our global identity as Shia Ithna Ashari Muslims who have this obligation beyond ourselves. And that's why I think the task of mental health and the work of this team and, the global teams in all Jamaats is to really push this forward as a collective effort. The second stream part of our strategy that I want to talk about is communication. And alhamdulillah, we have started just this week an empathy support line to enable people to call in at certain hours in the day and have someone who listens to them. And this is in order to provide the kind of crisis support and even just empathetic, someone to talk to, someone to make you feel less lonely. These volunteers have been trained, and the training program, alhamdulillah, has been really vibrant and successful, and the dedication within our people has been amazing. And I think, it is an important step in removing the stigma and bringing awareness to these issues, which is one of the first steps really in any strategy, is to acknowledge that this exists within our community at this time especially. And I think what's important with something like a support line or similar initiatives happening in other regions is the fact that it really meets people where they are at. I think too often we sometimes frame our language of coping and resilience and mental health in words that we feel comfortable with, whether that be spiritual language or religious language or language in the medical field, and not necessarily meeting people where they are at. Because, for example, if you have a child with a disability at home and no supports, if you are struggling with an eating disorder during the month of Ramadan, or worrying about how you might pay rent or get a job, the last thing you might need is, for someone to give you advice, but really for someone to listen. And I think that's an important service that we can offer to our communities. And we hope, inshallah, to build and continue this service and to expand it to frontline workers and providers who we know at this time, especially within our communities. I am privileged to be in a panel full of frontline professionals and workers who are, dealing with patients, who are managing these crises within clinics. And the moral distress and burnout for the frontline professionals, I think, is especially high within our community. But I think it puts us in a very valuable and special position where we can really step up to the plate and ensure that people in our community feel that they have a community of people who understand what they're going through. The last arm that I really want to talk about is collaboration. And I want to claim my bias and say that I don't know all the amazing things that are happening within the Jamaats, within, India, Pakistan, the UK. I'm here in North America and I have a very limited idea, but I think that's exactly where the opportunity is to support and collaborate globally with local Jamaat efforts, and to create a hub of initiatives so that we can learn from each other in terms of what works and what doesn't work. I talked about a few grassroots initiatives, and I'm sure we'll hear more as the program goes forward. But that includes even collaborations with other areas of our community and our talent, for example, media, and building, infographics and videos and generating the kind of data that needs to be generated in terms of giving tangible, practical mental health advice for those who are feeling trapped within quarantine, for those who feel, different feelings and need support required, and based off of that. And so I think collaborating with other arms of the World Federation is incredibly important. And I think also reframing our language around some of these issues is important when we talk about these things on a global platform like this. So instead of referring to, social distancing as a way to remove our social connectivity from each other, the idea of physical distancing is one that emphasizes that we are still socially connected. And so these are the three arms that I've really talked about: community resilience, communication, and collaboration. And these are the branches of what I'd hope that the viewers today would help join us in. And so again, my goal today was to raise some of the issues, some of the questions and the areas, and to introduce initiatives that we've already launched, like our support line initiative, but to invite you all really to continue this conversation further. Thank you.
Thank you so much. It's a very comprehensive strategy, and we really appreciate the hard work and efforts being made to support the community globally. I think one of the things that comes straight to me as a question is, how do I get hold of this helpline? How do I actually access it?
Great idea. So basically it's through Zoom as we have it right now. And so between the hours of 3 to 10 Eastern Standard Time, you can log on and there will be a volunteer at the other end waiting for you. And if there are more than a few people, then you will just be placed in a waiting room until the volunteer is finished. And so we hope, inshallah, to expand the hours, to expand it into regions, because as of now, those hours within our time zone are actually midnight hours within places like India, Pakistan, and East Africa. And so that might be convenient based off of our odd Ramadan timings, but I think to have more of a 24/7, and really ideally, to branch this out into something where it's not just people contacting us, but we're really contacting people. Because I think within, a small community, Jamaats I know are doing this and it's fantastic. And so I think to even build those capabilities is incredibly important.
Fantastic. And in terms of, so 3 to 10 Eastern Standard Time, I don't know what that means, but we'll all have to look it up after this meeting. How do people want to, your third point was about collaboration. We've heard from Sister Fazana about the amazing work Inspirational Minds is doing. We know we've got scholars like Sheikh Shamali, we've got other amazing consultant psychiatrists on this panel who can contribute such an amazing amount. How do they get in touch? How do they reach out?
I think it's simply by email or calling me. I'm happy to put, and here is the co-lead. So Dr. Mustafa Salim Muhammad is also an amazing resource as well. And he couldn't be here, but he's instrumental in helping make this and moving this forward. And so contacting either one of us, inshallah, will help, I think, build the kind of team that we need in order to create the response we want. Okay,
fantastic. Thank you so much. We are in an unbelievably privileged position today, because we've heard from Sheikh Shamali, an eminent scholar, teacher to many of us, in London. We've got Sister Frazana, who's been here, Zamina, who's in North America. And now we're going to move to a couple of speakers. One is based in the UK, but our first speaker is based in India, in Bhavnagar. And this is Dr. Ratnani. He's a practicing consultant psychiatrist. And he's written a book, Mansik Svatigya, containing information about various psychiatric illnesses in the Gujarati language. He is publishing Quarterly magazine and about the awareness of psychiatric illnesses. And he's got more than 10 national and international articles to his name, published in reputed medical journals. So we're very lucky to have him on the call today. And Dr. Ratnani, I want to bring you in to discuss, one of the key things about this crisis, which is how can we fight depression during the COVID-19 crisis, especially in this time of Shahr Ramadan. Dr. Ratnani, the floor is yours.
Thank you very much for kind introduction. Am I audible?
Yes, you are. Yeah.
Yes. Thank you for kind introduction. There are various news articles recently found that the prevalence of the anxiety disorders and depression is increased significantly by 20 to 30%. So I will talk about what can we do and why there is an increase in the prevalence of these illnesses. When there is uncertainty, like what is uncertainty about illness, how long this illness will persist, and how long our activity will be restricted, this kind of uncertainty leads to anxiety, and our coping with the anxiety really matters. And when there is a coping, we cannot cope with the anxiety, it may lead to some anxiety disorders like panic attacks or depression. So today I would like to talk about 5 things that I have identified that we can do at our home and we can avoid the anxiety and depression in this pandemic. First is sleep. We psychiatrists give very much importance to sleep. So today is a lockdown, we are not walking, we don't have to go anywhere. So majority of the persons complains that their sleep cycle is disturbed. So people wake up very late in the morning because there is no office, they are not working, they keep awake till late night. So their sleep cycle disturbs, and disturbed sleep cycles increases the risk for depression, anxiety disorders. So as a clinician, I give more importance to sleep. So I recommend to maintain the sleep as we used to work or in the pre-corona era, that was our sleep cycle. So I recommend to have a fixed time to sleep and go to bed and fixed time to awake in the morning, and try to maintain the fixed scheduled of working if we are working at home. Second thing, today we see that the informations regarding the corona is bombarded on us, or we see the overwhelming informations regarding the corona, that how much cases are there and how many people have died of corona in hourly basis. Like in India, there are cricket matches are very popular, and when the cricket match is going on, then people used to sit in front of a television and watch what is the score of a cricket match. So similarly, such the corona related informations and the cases and death related informations are overwhelmed on the news medias and all. So the overwhelmed informations regarding the corona and illnesses and death, see, it increases the anxiety. I understand that it is really important for us to know what's going on outside, how the illness is getting spread, and what is the current strategy by the government is taken, what is the instruction by the government. But it should be once or twice a day. But we should not get hourly basis of information related to corona, or in the majority of the social media, the post that I see, the majority of the posts are related to corona and the regarding the how many cases are there, and it increases the anxiety and fear. Third thing, I would recommend that people should use this time in their positive manner rather than this like wasting of this time, or like the talking about the corona and this illnesses and current situation only, many a times we have said ourselves that I might have done these things if I have a free time, or because of time constraint I'm not able to do this thing. So I think that we should try to indulge in those kind of activity that we couldn't have done because of the scarcity of time. Like somebody says that I would like to make a video, but I couldn't make because I don't have time. Somebody says that I have a hobby of writing or making good foods, or anything that we couldn't have done earlier because of scarcity of time. I think we should spare our time. We should spare our time in cultivating the new hobbies. Fourth thing is for those who having addiction. As a de-addiction specialist, we see many phone calls by the patients having a tobacco use disorder or alcohol use disorder, because there is a lockdown in the country. So those having this kind of addiction, they are not getting the substance to abuse it. So I think that people should consider it as an opportunity to get quit those bad habits. So as my practice in the de-addiction specialist, I see that the majority of the people says that they wanted to quit these bad habits, but they couldn't because of some work pressure on etc etc etc. I think this is the time where we have ample opportunity to get rid of these bad habits, and we can fight to get rid of these bad habits rather than wasting the time in the procurement of that substance and using it. Fifth is exercise or meditation or breathing exercise, that we should spare sometimes like 20 to 30 minutes a day in simple stretching exercise or aerobic exercise like this. Exercise is a natural antidepressant. It makes in release of certain neurotransmitter in the brain that have some antidepressant properties. So we can make the use of this exercise for as antidepressant action. And we also console ourselves many a times that I cannot spare the time for exercise, I cannot go to gym because of the lack of time. Now we have ample amount of time, we can do exercise at least 20 to 30 minutes a day. So my recommendation is this only 5 things that give importance to sleep: maintain the sleep regularity, maintain the sleep hygiene. Second thing, don't give too much time in the procurement of the corona related information. Don't get overwhelmed by corona related information. Third is give some time to yourself and doing the things that you would like to do but you couldn't have done because of scarcity of time. Fourth is you use this an opportunity to quit tobacco and alcohol like bad habits if you have. And fifth is exercise that you can do by yourself. These are my suggestions for you. Thank you very much.
Hassan, thank you so much, Dr. Adnani. And those are many things I think many of us within the medical field will echo. I think a lot of those recommendations are things that we talk about. I certainly tell my patients, use the time with a good schedule. Try to monitor how much information you're taking in, because it does seem like there's a lot of COVID-19 information. I call it COVIDload. Important to use the time we have wisely. I think Sheikh Shamali has given us some brilliant tips earlier, and inshallah we're going to bring him in after our next speaker to give us more tips. So we will, he'll be able to give us more advice on how to use that time. Of course, the self-improvement and addiction element is important. We've got Sister Zamina on the call with us, who is someone who's working with women who have substance use disorders. And we know this is a complex field. And sometimes we have over expectations, we're going to stop everything, but it's important to think about that. And maybe this can be a launch pad. Exercise, we've got some brilliant classes through the World Federation online and various Jamaats, especially in London. I know some brilliant exercise classes you can join in together. So exercise is another one, and it reduces a hormone called serotonin, which gives us that happiness. It's known as the happy hormone, and other endorphins. So these are all things that will help us improve and lift our mood. And of course, the final thing that Dr. Alani has mentioned is also something that the Prophet, peace be upon him, and his family have encouraged us in the sermon before Shahr Ramadan, which is sleep. We know that sleep in this month is worship as well. And we have Sheikh Shamali, and I'll ask him to maybe talk about that a little later. and certainly someone who's an advocate of sleep myself will take this worship act and do it to the most I can. We're going to now bring in another consultant psychiatrist before we move to our Q&A. We've got Dr. Abbas Ramji, and he's here based in the UK. So we've got a complement of all the various different countries today. Dr. Abbas Ramji is a consultant psychiatrist based here in the Midlands in England, and he's graduated with degrees in medicine and behavioral science from the University of Birmingham. He's also an honorary lecturer at the university, as well as a finals examiner for Birmingham and Nottingham medical schools. He's currently examining as well for the Royal College of Psychiatrists, and is the associate director of medical education in Derbyshire, where he does a lot of coordination of education events there. He's been a long-standing member, an active member of the Jamaat, and more recently he's been supporting the Birmingham Jamaat medics Al-Tabib, excuse me, that makes much more sense, task force, supporting and advising the Birmingham community during this pandemic. So he is a very welcome guest to the panel. And Dr. Abbas, I mean, with many people undergoing stress and anxiety, how can we deal with this? And what are the ways that we can provide support to our family and relatives who are also going through tough times? Dr. Abbas Ramji, the floor is yours.
Thank you. Assalamu alaikum, everyone, and Bismillahir Rahmanir Rahim. Thank you, Muhammad Abbas, for this introduction and for inviting me to the panel. First of all, before I just go into that, I just wanted to say, Sister Farzana, your story was so powerful, so moving and raw. And one thing that we can learn from your story is that when one faces such a challenge, one can show amazing strength and resilience. And I pray that we can sort of all draw from your strength in that. So with regards to the question, living with a mental illness can be extremely challenging, and the current coronavirus pandemic can clearly create additional problems. We must acknowledge that mental illness is very common, affecting roughly around 1 in 4 of us globally. Even if we do not have a diagnosed mental illness, we can all still struggle with anxiety and low mood due to the essential lockdown restrictions currently in place in many parts of the world, which are designed to help us all stay physically safe. But before answering the question, I'd like to just set some context and background. So anxiety is a natural phenomenon. It helps the human body respond and react to threat in a positive way, enabling us to defend and protect ourselves and our families. If we were to have no form of anxiety, our body would not be able to respond. And therefore, such anxiety can be important and healthy in certain circumstances. However, if the anxiety we experience goes beyond an acceptable level, the response to such an anxious thought and feeling can start interfering with our day-to-day lives and could then be considered an illness. So it's clear the coronavirus can affect everyone. However, despite taking all the precautions governments and health professionals advise, some may find themselves overly anxious, and this can present with various symptoms. And I know Dr. Ratnani has touched on some of this already. Symptoms of anxiety can include feeling sweaty and clammy, tummy pains, and a severe feeling of uneasiness. The uneasiness can take the form of fear, and this can have a significant impact on not being able to concentrate and make simple day-to-day decisions such as what to eat or how to manage money. Of course, we must ensure that we are not missing a physical illness. But if this has been excluded and we are certain of this, such symptoms can be part of an anxiety disorder. So when one struggles with anxiety, he or she may struggle to interact with others and may choose to keep to themselves, despite those that care for the individual offering to support and help out. So in such circumstances, one might struggle to think beyond the focus of their fear, for example, the coronavirus. As far as you are allowed, it is important to try to continue to maintain interaction with others, whether that be a phone call or a video call. It's important to try to engage in some exercise as far as is allowed, whether that be spending some time in the garden if you have one, or going for a short walk, as long as you stick to the social distancing rules. One form of anxiety disorder is obsessive compulsive disorder. And this is when you are occupied with a specific worry. You then keep thinking about this particular worry over and over again, despite knowing in your heart that that particular worry does not make sense, and despite trying to take your mind off it by distracting yourself by doing such things. Such a ruminative worry can lead you to acting on it compulsively, where you feel compelled to do a certain thing. So let me give you an example, the fear of contamination. This is a very real worry for many during this pandemic, and most will manage this worry by thoroughly washing their hands before carrying on with what they need to do safely. However, some may struggle to let go of the fear and may find themselves washing their hands repeatedly beyond an acceptable level, resulting in their day-to-day lives being impeded. We as a Muslim community are in a very privileged position. We have a tight-knitted structure that ensures that no one has to be on their own. If you are living alone or feeling socially isolated, you do not need to struggle on your own. Many communities, as has already been mentioned earlier, have set up COVID support lines, whether that's organized by your local mosque or by the wider local community. I know the Birmingham Jamaat have a very proactive group of volunteers, and I'm sure that is replicated in many other communities where volunteers will gladly call you to offer support. Such volunteers can help with practical measures, but there are also volunteers that can support when community members are struggling to manage emotionally too. I know that this can sometimes be a source of stigma within many communities, but now, more than ever, we need to support each other. We are living in an unprecedented state of international emergency, and yes, it is a worrying time, but inshallah, we will get through this stronger and more united than ever before. We need and must look out for each other. Asking for help and support at this time, including emotional support to ensure our mental well-being, is more important now than ever before. Even within friend and family circles, there is much we can do to support each other's mental well-being. So when we are struggling with anxiety, distraction is a useful short-term way of stopping ourselves and being caught up in negative thoughts or worries about an unknown future. It's something we can use or support each other with in order to use when we are finding it difficult to stop thinking or worrying. It does not involve trying to suppress negative thoughts, but instead it helps you to actively focus your attention on a different activity. So for example, types of distraction activities can include things like exercise and activity, which people have already mentioned, going for a walk or a bike ride, walking briskly, listening to the Quran, putting on the radio, doing some vigorous cleaning. How about thinking about something creative like drawing or painting, writing a diary, perhaps carrying out a DIY project, connecting with others. So phone or text a friend, help someone else, have a hug from someone special, talk about your problems with someone you trust. Consider soothing and calming activities. Take a bath or a shower, stroke a pet, have a warm drink after Maghrib. Practice meditation and mindfulness and relaxation activities. Think about constructive activities like sending an important email, spending 10 minutes tidying or organizing, cooking, gardening, writing a to-do list, volunteering your time for something proactive. Consider activities that require concentration, such as puzzles and crosswords. One of the most important things is self-care. Put on a nice outfit, write down something you like about yourself, and something that you are grateful for. I think in order to survive this COVID-19 crisis emotionally and psychologically, remember you are not alone. We are all feeling fear and anxiety. As I think Muhammad Abbas said earlier, limit your exposure to the news and social media. Look after yourself, exercise, rest, eat, and keep hydrated. Connect. Do not try to do this on your own. Ground yourself in normal activities and keep a structure and a routine. Ask yourself and your loved ones, how are you? And answer it honestly. Share your own vulnerability. And above all, lean on your support network. Working in secondary care psychiatric services in the NHS as a consultant in England, I've seen a significant rise in the number of people struggling with various mental illnesses over recent weeks during this pandemic. This includes various anxiety disorders as well as other mental illnesses like depression that Dr. Radnani mentioned earlier. If you feel you are struggling or may struggle at some point, please reach out because you are not alone. Community volunteers can offer support and signpost you to services that can support you further. Please remember, if you are struggling, it's important you contact your GP or health service straight away. Obviously in the UK, that is by dialing 111, but in many other regions, they will have similar systems. Your doctor is trained to recognize physical and mental illness and can support you through this with various forms of treatment, whether that be a supportive chat. They could arrange counseling or perhaps consider medication. In some cases, your GP could refer you on to a specialist such as a psychiatrist. During this challenging time, remember to stay at home and protect the health service and save lives, but also, whilst looking out for your mental health, remember there is no health without mental health, and that's a very important message that I like to convey. Thank you.
Hassan, thank you so much, Dr. Abbas Ramji. That is a fantastic ending summary, really encapsulating so many things that we need to consider. My pieces of paper are full now. I've just stopped writing now, but it's an incredible thing you've mentioned, because I think one of the things that we look at is the fact that we know that mental health is a big issue, but we also feel very isolated right now. We feel very siloed off. It's hard to speak to people, but many of your messages talk about how to actually help and self-care, like you mentioned, but also how we can reach out and how we can support. So really, thank you so much. And thank you to all of the panelists for all of the brilliant input we've had. I'm going to move to some questions. I mean, we're running, I think this might be the first miracle of Shahr Ramadan so far, which is that we're running to time. So Alhamdulillah, this is a fantastic achievement for us. And I think, given we have some time, I'd like to bring in Sheikh Shamali to kick off with a couple of questions that had come earlier. You know, Sheikh Shamali has mentioned, for those who are tuning in now, Sheikh Shamali mentioned that Alam al-Akbar is the great world within us that we need to focus on, the great world that we can actually look at, and something that many psychologists and psychiatrists talk about, that we actually have control over. You know, at the moment, we don't know what's going on around us, but we have control over this world of ourselves and how we can improve. So the first question comes off the back of that. And the sister has asked, during this lockdown period, what does Sheikh Shamali advise that we can do to benefit us? And the follow-up question for that was, without the mosques, how can we stay spiritually connected? Feel free to maybe answer the first one first, or if you feel they're connected, you can do that, Sheikh.
Thank you very much. Bismillah ar-Rahman ar-Rahim. Something which is very important is to always have plan. Even if we are going to have just one afternoon, we should plan and then start enjoying our afternoon, and for example say, okay, what I want to do in the first part, second part, third part. Now we have weeks of time, maybe months of time, and certainly this needs planning. I am sure there are many things that you were hoping to do, but you were always feeling that time is not enough. For example, having a good time for reflection, meditation, it's very important. We say in Islamic, spirituality, that tafakkur is one of the greatest ways of and methods of getting closer to Allah. The late Ayatollah Bahauddin, some of you might have heard his name. He was a friend of Imam Khomeini. He was a great mystic, very much respected, passed away a few years ago. One of his greatest methods was tafakkur. Tafakkur sa'a afdal min ibadat as-sana, or sattina sana or sab'ina sana, can be better than 1 year of ibadah without thinking, or 60 years or 70 years. About Abu Dhar, normally we know Abu Dhar for a person who is very active and very vocal, but actually Abu Dhar was very also contemplative. Kana akthara ibadat Abi Dhar tafakkur. So if we are not fortunate to go out, but we are fortunate to have good time for tafakkur, for contemplation. Now in the months of Ramadan, one of the best things to do in these months of Ramadan is to contemplate. What am I doing? What I have achieved so far? I'm sure we can always find areas that we can improve, and we can have a specific plans for improvement in that area. Many times we don't have time to connect to our family or friends. Now it's a good time that you phone, you have a Skype, with every cousin and friend or relative, to connect to them. Have a systematic study is very important. And also, when we are together in one house, still, this is not necessarily meaning that we have productive time together. Throughout the year, sometimes families, unfortunately, they don't spend that much time. For example, even sometimes they don't have one meal together. Everyone has his own breakfast, lunch is outside, they come at different times. Maybe in weekend they eat together. Now we are at home, but we should not think that just being together is enough physically. We should make a plan that how we eat together, how we have sometimes, I don't know, to watch something together, to discuss something together, maybe to do some exercise together. So planning is very important. Areas that we have to work and then allocating time to them, and you feel very, productive. I would like to share with you a story that I heard, and it remained in my mind. One of our scholars who used to be in London said that he used to be in charge of a project for tabligh in one of the universities in Iran. And he said, we realized that a person who was very high in his rank in party of, Communist Party in Iran, Tudeh. I don't know if you had heard the name of Hizb Tudeh. Hizb Tudeh was one of the communist parties who have experience of decades before revolution and few years after revolution. They were working closely with the Soviet Union. And this person was trained in Moscow, and he used to be in charge of some radio station for them. So now after revolution, he was in prison and he was in a cell alone. So they knew that he has lots of experiences in, promoting communism, and they thought we should go and talk to him and, listen to him and see what experiences he has. Maybe we can benefit from. So they asked the prison authorities, and they said, we should check with him, and he said it's fine. So they went to see him, and what was amazing and remained in my mind is this: he had only one cell. But he had made that cell, a small cell, into two parts. One part as his office, one part for living. And he said every day at a certain time, like for example, 8 a.m., I put on my, the best dress that I have in prison and go and sit on the other side and do my work like normal. When my office hours finishes, then I change my dress and sit the other side of the cell. And he gave them lots of, good advice. So you can be in home, but don't just take it as a, time that you can put on every dress, you can appear, like you like. No, be organized, be disciplined. This is the time that I want to do this, and I am very formal and official. This is the time that, I want to relax. So with planning, you can do lots of things that I think actually now is the best time. Few days ago, we were sitting with family, and everyone was saying, what is the first place you want to visit after this is over? And they asked me the same question. I said, I want to stay a few days more at home to finish some of my writing. So we have so many things to do, but you can think always, this is a disaster that has happened to me and suffer. You can say, this is a blessing that I want to enjoy. Your approach is, because, even if they put you in heaven, you can suffer. Say, why I cannot go and look at hell? I want to look at hell and see what is happening. So your approach is very important. You can totally change the situation based on your attitude.
That's very, Sheikh Shamali, that's very, very insightful, as always, because when we combine some of the medical things that we know that there's something called the sick roll. When patients decide that they're sick, they decide that they feel unwell, and they actually become more unwell because of their mindset. Whereas, as you said, mindset is everything. And of course, you have mentioned in your previous lectures the hadith of the Prophet, peace be upon him, that 70 years, 40 years of contemplation is 1 hour of contemplation is better than 70 or 40 years of worship. So of course, that's a fantastic thing for us to think about. I think one of the questions that's come through that is a follow-up to the whole discussion that I really want to get into, because I think it's so vital, is how can we break the taboo about mental health and depression? Someone said, I need to see a doctor, but I'm too scared to speak to my family about it. I mean, I will signpost that as part of Inspirational Minds, we spoke about this, and I have myself given a lecture on depression about a year or two ago and it's on the Hujjat website, YouTube channel. You can look at it, and it talks about some of the other members of the community who've come forward. But I'd welcome the panel's thoughts. This is for everyone. This is something that's affecting our community. We need to talk about it. And Sheikh Shamali has spoken so beautifully about spiritual elements of it. Why are we not talking about mental health more in our communities? Farzana?
Yes, just tapping into what you've said. Alhamdulillah, at Inspirational Minds, we run events, picking up topics that come in accordance. So when it's a referral service. So as referrals come in, we see what issues are quite prevalent at that time, and then we'll set up events in relation to that. And also those events then increase the amount of referrals that come in. So it kind of helps keep the topic afloat, which is again what helps with the taboo, right? If the topic is continuously discussed, people become more comfortable with that particular topic. If it's around mental health, initially I remember we started events discussing emotional well-being, although it's the same thing, but it's the mindset of how people understand mental health and what it means. And then finally, after a few events, we were able to say mental health. And I think it's as simple as that. The more we discuss it, the more we talk about it, the more we have events, and the more we give space for people to reach out to us as professionals within a community, I feel, more so than outside.
You've mentioned previously, and has been mentioned by the panel, has been normalizing mental health. We are trying to normalize our feelings, our emotions. I miss the community. I miss spending time with all of my brothers and sisters and sitting in the majlis and hearing Sheikh speak and serving each other and sharing a date and all these brilliant things that come about in Shahr Ramadan. It's okay to feel that, and it's important that we start sharing how we feel. I want to bring in Sister Zamina, because I think one thing that Dr. Mitani had mentioned earlier was around substance misuse and substance abuse. And I think one thing I would, Sheikh Shamali has given us a lovely concept. Utilize this time to start walking and planning the path that you want to take. As many of us always say, I have no time, I have no time. Suddenly we have time and we say, oh, I want to be back to my normal life. And actually Sheikh Shamali is telling us about how he has used it constructively on his writings and his efforts. How can people use this time, Zamina, as a time to delve into substance abuse and look into that? And I'm worried we've only got about 15 minutes, but I do want to spend a couple of minutes on this, because I think it'd be really great, maybe just to kick off the discussion, and then we can have follow-ups at later stage.
Yeah, inshallah. I'm sure the physicians on the panel would be able to speak to it probably better than I can. But from my perspective, I think that it's important for us to realize that addiction is a chronic relapsing disorder. And so when we reframe the idea of substance use, instead of it being something that is sinful, something that merits that person be ostracized from our community, that they are deviant, that they should not be allowed to participate and integrate within spiritual programming or within community and social activities, I think that's the wrong approach to take. And recognizing it, understanding it, the listeners, I'm very sure that someone within the audience might know someone who suffers from a substance use disorder or problematic substance use. So recognizing that it exists is very important. And also, understanding that, the way to support people is by reaching out to them, because by being alone, quarantined, in lockdown, that becomes a very difficult environment for people. They feel trapped all over again. They might actually spiral back into certain habits instead of spiral back out of them. And it can really become quite intense if they have no one to talk to or nowhere to reach out. So I think as a spiritual community, it is our responsibility to make sure that we're reaching out to these people, not necessarily to give advice or to preach a solution to them, but just to check in and say, hey, how are you doing? I was thinking of you. So even basic, akhlaq and social etiquette to really make our community feel more connected is the way that we let people who are suffering from this disease know that they are not alone in the fact that they are struggling, that we see them, we recognize them. And then I think the next steps go into, connecting them with providers if that's necessary or support, but recognizing it first and acknowledging them as humans before anything, and acknowledging this as a disease, I think is important.
Absolutely. And I think, there are many things that we can draw parallels with. Sometimes we think it's not a spiritual element, but we know about the hadith of the Prophet, peace be upon him, when there is somebody who is so engrossed in worship, you might call them addicted to it, that the Prophet stops everything and calls everyone and says, look, and gives a sermon about spending time with your family and your loved ones. Sheikh Shamali is on our call, so I won't speak on hadith at all because we have a supreme expert, mashallah, with us. But what I would like to do is bring you in, Sheikh, on this, because I think whilst we do have, again, a couple of minutes, just a bit more on this discussion before we move on to sort of 4 or 5 other questions that come on. But Sheikh Shamali, substance misuse, substance abuse, it's not covered a lot in our community. It's something that people are very reluctant to talk about. But it's something that's so important that we work on and support our communities and people suffering it. I mean, Sheikh, how would you look at it from the sphere of spirituality, and how can people start making steps to improve this and work on this problem they have?
Alhamdulillah, those who are really committed to family and community life, they are, for the most part, safe from these problems. I have this experience that many times people who come and asking for help, even financial help, are the people who are not frequently connected to the community. Because if you are connected to the family and community, you have a nice environment that either many problems don't happen to you, or if they happen, you have a support. People who maybe share with us, for example, the same faith or ethnicity, but they are not actively part of community and they don't have, a strong family life. Normally, these are the people that suffer from these problems. This is my experience, over years, that those who have a strong family and community life, many problems don't happen to them.
Absolutely.
Maybe their children are not like them. That's another issue. So it's very important that we, adult children, all appreciate more. Now, this is one of the things that, we can, inshallah, better appreciate, because we used to take it for granted.
Absolutely.
That if you want to have a bright future for yourself and family, be very much attached to a community of the faithful, where you have people with different experiences, different expertise. And when we come together, we bring the best of the world to that place. Absolutely. So this is very important.
Sheikh, I mean, what you said and what Sister Zamna said, really they tie in together. It's so important to be connected to each other, and it's so important to check in, as Sister Zamna said, on one another.
Yeah.
I guess the follow-up question, which is also something that people have emailed us and messaged us about, which is a great tie-in, is in this time, and I'm gonna bring in some of the psychiatrists as well on the group as well in a moment. First, before that, in terms of in this time when we are physically distancing from one another, it doesn't quite feel the same, a Zoom call or a checking in online, a FaceTime, whatever you utilize. And I guess you know, you miss that proximity, you know, you miss the congregational prayers. How can we, in light of that, how can we maintain our spiritual connection with each other during this period of time? That's for you, Sheikh. And then after that, I'm going to ask Dr. Abbas and Dr. Radnani to tell me more about how we can do it from a medical side. But Sheikh Shamali, please.
You know, actually, I think what happened, we can turn it into opportunity. You know, now that we are always talking on Zoom and listening, you know, on internet, and I think if we were going the same line that we used to, after 10, 20 years, all of us without virus, we would have reached this point. That we don't come out as home and doing everything from home, from in front of the computer, and this is mobile. This reminded us that we are human beings partly because of our social aspect. You know, it's very common definition. They say, al-insanu haywanun madaniyun bit-tab'. By nature, we are social. If you take away our social aspect, we are no longer a complete human being. But the way we were driven by technology, especially information technology, was that the more and more we were isolated. We think we are connected to all over the world, but this was a misconception. We were just connected at the surface, but we were disconnected even from people in our own community and people in our neighborhood. So I think this is a blessing that now we realize that there is so much of wealth in our relations, just going to outside, shaking hand with the neighbors, greeting, talking, not minding about, you know, for example, you know, distance. This is something that we have to preserve and revive.
Absolutely. And it speaks to many of the things that we are doing nowadays, where we are being told, I mean, for years, scholars have told us, say shukr, give thanks to Allah subhanahu wa ta'ala for all the blessings we have. But now psychologists and psychiatrists and the mental health fields are talking a lot about the importance of gratitude and how that helps with well-being. So I want to bring in our psychiatrists now, Dr. Radnani and Dr. Ramji. We have you on the call, and the thing I want to discuss is that based on all of this, you know, a lot of questions we're getting is about how to deal with feeling low when you can't see your family and friends. You know, practical tips, spiritual tips, of course, are key, and they are practical as well. But from an uncertainty perspective, you know, one of the things we find hardest in medicine is dealing with uncertainty. You know, when we're not quite sure what's wrong, that also makes patients feel very unhappy. In fact, sometimes they feel happier knowing they have something serious rather than not knowing they have anything at all, which sounds strange, but is true. I mean, I'll bring in Dr. Radnani first. You know, you had mentioned some practical tips. I think one of the tips I think was about, you know, you mentioned sleep, schedule, that sort of thing. Is there anything else that you would say that we can utilize to manage uncertainty? We've got about a minute or two for this, and then I'm going to bring in Dr. Ramji, if that's okay, for a couple of minutes, and then we're going to have to wrap up, even though there's so many things to discuss. But Dr. Radnani, to you, please.
Sorry, I don't understood your question. There was some voice problem here.
Sure. Sorry. The question is that how do we as people in the current uncertain climate we're in, how do we deal with that uncertainty? What can we do to make ourselves feel calmer?
What can we do ourselves to feel comfortable?
Yes, and calm and not so anxious.
So as I recommend that the more we will try to escape from the situation, more we will feel fearful or more we will feel anxious. So I think we should accept the reality and we should focus on the things that is in our hand. We should focus on the I often say that there is a two circle. One is circle of concern and another is a circle of influence. So COVID pandemic is a concern for us, but we cannot influence it. So I think we should focus on our circle of influence, that what things we can do and what changes we can make in our day-to-day life and in our surrounding. So I think this is the thing we can do.
Awesome, thank you. Which speaks exactly to what Sheikh Shamali said right at the beginning of the program about our control of Alam al-Akbar, the world inside us. It's incredible the way that we're aligning. Dr. Abbas, you know, you got the final word. Tell us, you know, a minute or two on how patients can manage that uncertainty and how we can manage really the lack of being close, the proximity that we miss so much.
I guess what we talk about social distancing, and actually I feel it's a bit of a misnomer. We're physically distancing, but actually socially, on the contrary, perhaps this is an opportunity. Like Sheikh Shamali said earlier, it's an opportunity to actually connect even more than we've ever done before. And I certainly feel that I've connected more with my family members across the world more than I've ever done before. For example, last Sunday, I had a Zoom call with various members of my family. I had a cousin from Seattle, I had an uncle from Toronto, I had family members from Karachi, Stockholm, and they were all on the call together. And that rarely happens under normal circumstances. Actually, on the contrary, I feel I've connected more than I've ever done before. And imagine if this pandemic were to have taken place perhaps 15, 20 years ago, we wouldn't have had this opportunity to connect in this way. So I think it's turning this into an opportunity. And yes, there is uncertainty. We don't know how long this will go on for, but actually it's about maximizing the time that we have and maximizing the opportunities that we have. For example, in the UK, I'm sure Mohammed Abbas and Farzana, who are based in London, have experience of this Thursday night 8 p.m. clapping situation that we have, where we're out on the streets clapping for our key frontline workers. And actually, you know, particularly on my street, the whole street is out standing on their front driveways clapping at 8 o'clock to applaud the health service workers, the frontline workers. And actually, you know, it's actually created a real sense of community that probably wasn't there before. So it's about connecting, using the opportunities that we have, being opportunistic in that way. And I guess, you know, coming on to what Sister Zamina and Sheikh Shamali said earlier about connecting and talking about mental health within our communities, change starts with small movements, and setting up events within communities is one step. And you know, that can help start people talking. And it just takes one person to be open and being able to share their experiences and talk, and that will help encourage others to talk. And it's about utilizing these personal stories that can be just so powerful, and that hopefully will inspire other people as well.
Thank you so much. I mean, that's fantastic and valuable advice, and a really fantastic note for us to end our discussion on. Today we have been discussing mental health. We've been discussing the struggles of anxiety and worries during the COVID crisis. And what has come out from it has been the importance of community, the importance of how we support one another. And that's something echoed by all of our guests. So I'd like to first thank them all. Wherever you are in your houses, please recite salawat for Sheikh Shamali, Zamina Matani, Farzana Karawali, Dr. Abbas Ramji, and Dr. Ratnani, who have all joined us from across the world to give their expertise and their time in a time when we are struggling for time, and you know, we're fasting, and they have given all of their expertise and energy and support and advice. So we really thank them so much. I would say that some of the learnings I've got from today to help summarize the discussions are, it's important for us to normalize the mental health concerns and anxieties and our feelings. And what is most powerful at this time is utilizing the time for good, utilizing the time for working on ourselves, and taking the opportunity to do so, as mentioned by Sheikh Shamali and summarized by Dr. Abbas at the end. But I think the final thing and the sentiment that we'd want to leave you with here from the World Federation is the importance of peer-to-peer support and of us being a global community. We all love one another. We are all here to support one another. And that's why we've hosted this program. And I would urge anyone who's feeling low, anyone who's feeling anxious, anyone who's finding that they're struggling at this time, to get in touch with us. You know, go on the World Federation website, drop us an email, and we're more than happy to support with anything you need. The final thing I would like to ask all of our viewers is that one of our panelists, Farzana, she has been an activist in mental health for a long time. She is a fantastic contributor to the community. We received the very sad news of her father passing away, and he was buried today. And in light of that, we would ask that you do remember him in your Salat al-Wahshat, in the Namaz al-Hadiya Mayyat today. His name is Murtaza Hirji Walji. We would thank her significantly for bravely talking about bereavement and how we can cope with that. And of course, we ask you to remember him in your Surah Fatiha, and of course, all of us in your du'as. And that will be the conclusion of the call. Thank you very much for tuning in. Wassalamu alaikum wa rahmatullahi wa barakatuh.